Hey guys, welcome back to the channel. This is Nursing with Ray. I'm Ray, yours truly, and if you're new to the channel, please subscribe, leave a like on this video, and leave a comment down below. Also, if you want to cop this shirt that I'm wearing, go ahead and follow Ray's Nursing Apparel on Instagram and go copy your shirt over there. Without further ado, let's get into today's video. In today's video, as you can tell by the title, I'm gonna be answering Google's most searched questions about nurses. I think I said that wrong. The most frequently searched questions about nurses. Yeah, that sounded like a bit better. Okay, so let's just get into it. So the first question I see: are nurses rich? Okay, so just putting this out there first, I am no expert. I'm no expert or anything. I'm just a first-year nursing student, so these questions are purely going to be based on my knowledge. If I do get something wrong, please let me know in the comments down below. So are nurses rich? I would say no. Nurses are not rich. Nursing is quite an underpaid profession. And I believe we can all agree on that. So no, nurses are not rich. The next question is, why are nurses so mean? Well, okay, I wouldn't say nurses are mean. I mean, we're individuals. I'm not a nurse yet, but they're individuals just like everybody else, and so you're gonna have good ones and bad ones. So you're gonna have good nurses who are nice, you're gonna have nurses who maybe are not so nice, maybe are a little bit mean, but all nurses are not mean. And the nurses who are mean, I would say it's because of burnout. So from being overworked and underpaid, stuff like that, just family life stresses and all the stresses that come with life. So all nurses are not mean, but the ones who are, that's the reason why. The next question is, do nurses usually marry doctors? Why, but Jesus? I would say no. I mean, what, I don't know, people just have that illusion in their head, like, I don't know, like a nurse is supposed to marry a doctor and just live happily ever after or whatever. But I mean, I don't think they do. Not saying that there aren't nurses who marry doctors, because yeah, I mean, whatever. But for the most part, I've actually heard nurses say that they don't want to marry doctors because they want somebody with like different interests than they do, so they can have like different conversations and whatever. So yeah. The next question is, what kind of nurses get paid the most? Okay, so from my knowledge, I would say nurse anesthetists get paid the most. So if you're not sure what that is, it's a certified registered nurse anesthetist, or CRNA. They basically do work in the OR, in the operating room, and they assist, or maybe assist isn't the right word, but they provide anesthesia for the patients in surgery, along with like the anesthesiologist and whatever. So they work in the operating room, and it's actually pretty hard to get into a CRNA program, and it's really high up there on the pay scale. So I would say CRNAs kind of make the most money. Yeah. The next question is nursing a good career? So I would say nursing is a good career. And I mean, yes, we all know that nursing is quite not the best when it comes to pay as what I believe it should be, but it is a good career because, one, as a nurse, you can never be out of a job. You are always going to need, we are always going to need healthcare professionals, because people are always going to be getting sick. So as a nurse, you can never be out of a job, you know, especially now with the day and age that we're in, with technology taking over a lot of jobs that people used to do. As a nurse, a computer can never take your job. So I would say it's a good profession because you have job security. Another thing is that even though nurses don't make the most money, you do make a livable income. So it's a stable income that you can live off of. And nursing is very flexible. So there's a lot of ways that you can do a lot more side hustles to make more money as a nurse. So overall, I would say nursing is a great career, a great profession. The next question I see is, what exactly does a nurse do? And I feel like a lot of people are not informed enough when it comes to what nurses actually do. So nurses do a lot of things. We administer medication, we provide basic care for patients like bathing, feeding, things like that. We do carry out some other medical procedures, inserting IVs, giving injections, inserting NG tubes, catheters, checking vital signs, communicating with doctors, coming up with patient care plans for how the patient is going to be cared for, communicating with family. It's like a lot of stuff. The role of a nurse is quite wide, and I feel like even Jamaicans especially, we're very uninformed about what nurses do, because even me, I've been told all the time, like, why are you doing nursing? You're too smart for that, whatever. Because I told you guys before, I shared this on my channel before, that I actually wanted to be a doctor ever since I was a little girl. And because circumstances, I decided I was going to do my nursing degree and whatever. And then I ended up falling in love with it. So a lot of people have been telling me, why am I doing nursing? I'm smarter than that, whatever. A lot of Jamaicans feel like all nurses do is, quote unquote, dress sore foot and clean doodle. That's not true. That's not true. Nurses do a lot, trust me. Another question that I see is, what is the easiest nursing job? And I'm kind of skeptical about answering this question because I don't feel like any nursing job is easy. And there's so many different jobs that nurses do, different places that nurses can work. I don't even know how to answer this, but I'm gonna go out on a limb, and school nurses don't come for me. But I would say maybe being a school nurse is probably a little bit on the easier side, because, I mean, and I'm just speaking from what I've seen being in school. The school nurses are literally just in their office, and when you come in there, they'll probably just call your mom, give you an ice pack or whatever, give you some Tylenol or whatever, and have you, or some aspirin, and have you move along. So I would say being a school nurse is probably one of the easiest nursing jobs. Please don't come for me. But in terms of like how much physical work you have to do, I would say it's very little bit. So maybe. Another question I see is, what are RNs not allowed to do? So things registered nurses aren't allowed to do. We aren't allowed to prescribe medication, of course. Only certain nurse practitioners and doctors can prescribe. And we can't perform surgeries or certain invasive procedures, although some RNs can specialize in doing little minor procedures. On the general scope of an RN, you can't do certain surgeries. You'd have to get like some sort of additional certification for that. Like some RNs, they can do some other stuff. I don't even want to get into it because I don't want to say something that's wrong, but yeah. As far as it goes, I think that's probably the only things RNs can't do. We can't prescribe and we can't do surgery. Yeah. The next question is nursing a stressful career? So I would indeed say nursing is a stressful career based on what I've seen nurses been saying from the dawn of time. And even being a nursing student is stressful as hell. So yes, nursing is a stressful career, but I mean, if you love it, if you want it, go for it. It's not impossible. Next question I see is, how long does it take to become a registered nurse? So this becoming an RN can take you anywhere from 3 to 5 years, actually, anywhere between there. So a bachelor's degree, which is the most common nursing degree, can take you 4 to 5 years, but I see they're coming in with a lot of accelerated BSN programs where you can finish your nursing degree in as little as like 2.5 years, 3 years, whatever. And you have ADN nurses are associate's degree, so they're registered nurses with an associate's degree. That can take you anywhere from 2 to 3 years to get your associate's. So becoming an RN can take you as little as 2.5 years to up to 5 years. The next question that I see is, do nurses have to clean poop? Yes, 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 yes. Nurses have to clean poop, but it depends. How often depends on where you're working. So if you're working in like a private practice, if you're working in anywhere other than the hospital, you probably won't have to clean poop. And in the hospital, depending on which section you're working, will determine how much poop you have to clean. But yeah, you have to. So yeah, guys, those are some of the most popular questions about nurses on Google. I hope you enjoyed this video. Please remember to subscribe, like, comment down below, share this video if you care, and stay tuned for